Welcome to Roadmap to Residency. Hello everyone, I'm Abhiraz, and in this video we will be talking about sexually transmitted infections. So which of the following complication is commonly associated with untreated chlamydial infection in women? A 22-year-old sexually active woman presents with lower abdominal pain, dysuria, and increased vaginal discharge. On pelvic examination, cervical motion tenderness is noted. A nucleic acid amplification test confirms the diagnosis of Chlamydia trachomatis infection. Which of the following complication is commonly associated with untreated chlamydial infection in women? Ovarian cyst, PID, urethral stricture, cervical cancer, or endometrial hyperplasia. So PID, so untreated chlamydial infection in women can ascend from the cervix to the upper reproductive tract, leading to pelvic inflammatory disease. PID is an inflammatory condition that can involve the uterus, fallopian tubes, and ovaries. It is a serious complication that can result in the chronic pelvic pain, infertility, and ectopic pregnancies. So Chlamydia trachomatis infection. So Chlamydia trachomatis is an obligate intracellular bacterium that infects the human mucosal epithelial cells of the oropharynx, genital tract, anorectal area, and conjunctiva. Chlamydia trachomatis can be found in the endothelium and epithelium of the endocervix, rectum, peritoneal cavity, fallopian tubes, oropharynx, and conjunctiva. And this is the picture of Chlamydia trachomatis. So the incubation period is 7 to 21 days. In 60% of women and at least 25% of men, chlamydia infection is asymptomatic. Chlamydia trachomatis virulence factor. So intracellular replication, which protects them from the host immune defense. It prevents the fusion of phagolysosome. It has repeated infections, and the serotypes A to K and L1, L2, L3 identifies the strains and clinical manifestations. So women may present with non-specific symptoms such as abnormal vaginal discharge and bleeding due to cervicitis, dysuria, pyuria, abdominal pain, and fever due to PID. And in men, dysuria, urethral discharge, or epididymitis, which is the pain and swelling of the testis, may be present. Complication of chlamydia trachomatis infection. The number one complication is PID and infertility. Trachoma inclusion conjunctivitis may be there in neonate. Prostatitis or epididymitis or varicositis is one of the complications in a male patient. Ritter syndrome, where there is arthritis, conjunctivitis, and uveitis. And the Fitz-Hugher-Curtis syndrome, where in the right upper quadrant, there is abdominal pain in a sexually active person. So investigation, you need to must rule out gonococcal infection. You take the sample of urethral and cervical scrapings, do the microscopic examination and culture in the McCoy media. You can also do the antigen detection by ELISA and PCR. So gonorrhea is one of the common and high contagious sexually transmitted diseases caused by Neisseria gonorrhea, which differ in male and females in course, severity, and ease of recognition, and can lead to different systemic complications if left untreated. So gonorrhea is by neonatal, which can be acquired either by neonatal transmission, sexual transmission, or auto inoculation. The bacterial components, including the pili and other proteins, allow the adherence to host mucosal cells, and it causes attachment to the mucosal cell surface. The bacterial porins and proteins from pores in host cell membrane, inducing endocytosis by host epithelial cells. Bacteria invade and replicate within the columnar epithelial cells, and it can cause the host immune response, which will cause the successful eradication of pathogen. Pathogen is cleared from the host. Bacterial phagocytosis by circulating monocytes can cause unsuccessful eradication of pathogen, and it can cause the dissemination of pathogen due to that. And this all will lead to the antigenic variation of proteins in LPS of bacteria. The masking of gonococcal antigen by LPS prevents the binding of bactericidal antibodies and can cause incomplete activation of complement system. And this all ultimately will lead to the sign and symptom of gonorrhea infection. So the lab diagnosis include the specimen collection, the gamma microscopy, culture on increased selective medium, examine the colonies of suspected colonies, and perform oxidase test, perform rapid carbohydrate utilization test, slide agglutination test, conduct antimicrobial susceptibility test. Treatment is by intramuscular penicillin or oral ampicillin or doxycycline. So which of the following is another common site for infection in individuals with gonorrhea? 28-year-old man presents with urethritis and purulent discharge from the penis. He reports discomfort and a burning sensation from during urination. Gram stain of the urethral discharge reveals intracellular gram-negative Pneumococci. Nucleic acid amplification testing confirms the diagnosis of Neisseria gonorrhea infection. Which of the following is another common site for infection in individual with gonorrhea? Rectum, urethra, vagina, prostate, and epididymitis. So rectum gonorrhea can involve various mucosal surfaces, and the rectum is a common site of infection in individuals with gonorrhea. Rectal gonorrhea may cause symptoms such as anal discomfort, discharge, and pain during bowel movements. And in men who have sex with men and engage in receptive anal intercourse, rectal gonorrhea is more prevalent. Thank you for watching. Keep studying hard.